Hey, Dr. Khris Ramdeen. How are you doing, my friend?
Good, Jamal. Thanks for inviting me.
No, I'm glad to have you on
Well,
here.
back inside, so we're virtual.
Yeah, I'm really glad that I'm actually able to, see you and check in with you because I know you were crazy busy for a while and probably still are right now. It's hard to get doctors to do anything right now because you guys are like, really, you may as well be cops right now. You're really on the front lines for real. So I'm glad you're here. I, of course, know you very well, as most people on these videos, that's the case for them. But I want to make sure everybody else knows you. So tell everybody a little bit about you. I will say that this is Dr. Khris Ramdeen. He's a friend of mine. He's actually my physician as well. Um, so he knows, I had another friend on here, was one of my best friends from law school. And I guess I should never get the two of you guys together because all my dirt is, I'm just saying, is in those two buckets. But no, this is my friend, my doctor. He's actually been my client as well, and really just a great physician. And so I want folks to get to know you a little bit better. So please tell everybody a little bit about yourself, Dr. Ramdeen.
Well, thanks for the intro, Jamal. And Jamal is my, attorney too. So we're friends, and we have a relationship. But I love bouncing ideas off of you, and it's become more than just doctor, patient, attorney, client. We're
Yeah,
talking about bigger issues, and how just being in these fields affects us in a way that we're not really can't really talk about. So it's nice to have that
absolutely.
support system. But this is important too, where we were talking a little bit earlier about doctors and patients being completely separated because we're telling you to stay home and you're looking at, when do we get to come outside. But looking forward to dive into that with you. But again, I'm Dr. Ramdeen. I'm an internal medicine doc. I've got over 10 years experience in the field. And I'm also a personal trainer. So I really love fitness. Jamal knows this. And so
And
through
that's
my,
how we met
yeah,
at
yeah,
the
we met in
gym.
the gym. Yeah. And so through my fitness journey, I was doing my medical training. So when I was trying to figure out how to build muscle, hypertrophy, how to get abs, how to cut fat, all that stuff, I was trying to tie it into medicine as I went. And then so I became a personal trainer and then eventually started a practice after doing hospitalist medicine for a while, which is something I still do. Basically means that if you come to the hospital and you're sick enough to get through the ER and be admitted into the hospital, that's when I take over. That's a hospitalist. And so I've done that. I still do it and I love it. And I do legal consulting too. I like the expert witness stuff. I do medical directorships. I've been a director of a nursing home, hospice facility. I'm in the process of getting credentialed to do some acute rehab facilities here in Austin. I like teaching. I like doing this stuff. I like just going to anywhere, anyone that wants me to come by and doing Q&As because this is how you promote public health by having me be there and not sending pamphlets to your house. I want to answer questions in real time, kind of like what this is. But I try to be active on social media, like Instagram mainly is where I am, because again, everyone's on their phone scrolling. They don't really care about the fact that I was a chief resident or clinical professor at university. They don't really, that's nice, but what do you know about intermittent fasting? How do you get abs? Well, tell me about testosterone. That's what people want to know. And so I try to be on a platform that people have access to. And that's how I try to push prevention, which is my passion. How do I prevent diabetes, heart disease, strokes, obesity, all that stuff? You can't just talk about, I found over the years of selling prevention as these plaques building up on your arterial walls, the vessels feeding your heart or brain over decades. If you don't eat right, if you don't exercise, it's really hard for a young guy like you or a 20-year-old to think that far ahead. But if I talk about abs and losing weight, you can see that in a couple of weeks. Now I get the 20-year-old even to say, okay, wait, how do you eat? Tell me what labs I need to check. And I pull them into prevention, screening for diabetes, cholesterol, kidney, liver function, electrolytes. And I've worked at the transplant hospital for a while too, in San Antonio, liver and kidney transplants. So I see damage of those organs from supplement use, from safe places like GNC, Whole Foods, Vitamin Shop, really reputable places. But there's, as you know, Jamal, being an attorney, there's no FDA regulated body that governs that. It's like, you don't have to prove safety, efficacy, quality, just free for all. And so you end up getting electrolyte abnormalities and some organ dysfunction. So basically the way I approach everything is do what you're going to do, but let me evaluate you, make sure it's safe. And while you're doing whatever you're doing, let me monitor your organ function and your electrolytes. And if something falls off, we'll reevaluate what you're doing and say, hey, change this, stop that. But basically just have a safety net under you while you're doing what you're doing. That's my goal. I want you to augment your lifestyle and tweak it, make it more efficient, make it more intense. I don't want to completely change it and now make you vegan or make you a carnivore diet or tell you to do keto or paleo. Maybe there's something, the Venn diagram where everything overlaps, that's where I want to make a difference in your life. So that's my approach.
All right. And so you're modest, and that's really nice. And I'm glad you shared all of that information. But you're all, so I mean, you're not just the average doctor though. So it's not like you're just seeing patients and working in a hospital. You also are a business person. So you run your own concierge physician practice, which I want to talk a little bit about, what a concierge physician is and what they aren't, because a lot of folks first heard about concierge physicians when Michael Jackson died. And there's a really bad rap that you hire this doctor and they just do whatever you tell them to do and give you whatever prescription you couldn't get from anyone else. But then you also have you also have like the spa, where you're actually like providing like a kind of holistic medical fitness approach for just people like just to come physically in and like I don't, it's not hard. It's not easy for me to describe it. I want you to talk a little about that because that's a whole business that you started in San Antonio that I know you have plans to grow because I've been a part of helping you put that together, and it's going to, eventually maybe grow into something that becomes a national model. There are a lot of doctors I know, a lot of doctors are not business minded at all. They don't think about this kind of stuff at all. And since the beginning of working with you, I know you've always been thinking about how to build something that's scalable, that's reproducible, that could actually be something that other folks could partner in and become a part of, and that could provide an impact across the country, which is exactly what a business person would be doing. So I want you to talk about that.
And let me throw a compliment back at you because you say doctors aren't really business minded. I find personally that that's often the case. And even with attorneys, when you go to an attorney with a healthcare question, they'll spit out all the legalese to you, send you on your way. You have a question, I don't know, that's great. But you have a lot of experience with the healthcare industry, with docs. And so it was a really good match. And so I'll start there and then I'll go to what concierge medicine is. What is it, right? And so basically, if you had to boil it down, the model exists so that I can spend more time with you as a patient and you can spend more time with me. And time is everything, right? I look at it as being a good detective, being a good doctor, right? So if you give Sherlock Holmes 5 minutes to solve a complicated case, it doesn't matter how good you are, it's going to be near impossible to do it well, right? So if you're in the typical model where it's not concierge and you go into basically a doc that accepts insurance, now that doc in that practice has to hire a team to deal with the insurance company. And that money to pay that team has to come from somewhere. It's got to come from the patient. And so if the patients are in essence indirectly responsible for paying that team, you now have to have a volume-based practice where you're packing the waiting rooms all the time just to keep everything going. Trust me, it's not to make anyone rich. I know doctors that have closed down practices because they say, I don't really make a profit until the 27th day of the month. 2 bad days, and now you're underwater. So there's that model where you're coming in, coming out, coming in, coming out. The doctor's seeing multiple patients and no one's happy. The patients are thinking, the doctors are just trying to see a ton of patients to make a ton of money. And then the doctors are thinking, man, I wish I had 5, 10, 15, 20 more minutes with that patient. I could have really dived deeper, but now I'm forced into a more cookie cutter mindset where you have this, take that, you have this, it's more algorithmic thinking. And so with concierge practice, I don't have that problem because I don't really deal with insurance companies much. So if you come in and I'm doing your intake, if I want to spend 2 hours with you, I will, and if you have a question for me after you leave, those, they call it the doorknob questions where you get in you're about to leave or you're in your car, you close the door and I forgot to ask that question. You can reach out to me directly. You're always connected to me. And so the relationship is better to the point where, and Jamal, you probably know this, where insurance companies actually give discounts to patients who have concierge doctors because they know the care is more intimate, and they know the outcomes are better. So they're less liable for paying for things like diabetes complications,
Right.
high blood pressure, heart disease. And so Concierge does that. It lowers the patient census, so I have more time to spend with the patients I do have. And then it allows me to practice within my niche. My niche is fitness and integrating fitness with internal medicine. You may find a doc that is amazing and really well researched in cystic fibrosis, and you have cystic fibrosis. Well, then you want to go to that doc, right? So I feel like I can be myself with my passion, integrate it with medicine, do preventative care, and make fitness part of medicine, where in the past it's been separated out so much so that when you're in medical school, they'll tell you, make sure you tell the patient to exercise this amount of time for this amount of times a week. So if I said to Jamal or somebody else who was, let's say, obese, right? And you need to lose weight. And I'm saying, well, try to work out more and eat right, and half an hour a day, 3 times a week. Bye. And then they're sitting there, where do I even begin? But I want to know, what workout regimen are you doing? How can I make it safer? I want to look at your posture. Maybe you're doing something that will hurt you. I want to check your EKG, which is not typically done on an initial visit where insurance would cover it. Because if you have an arrhythmia or some heart issue, and I'm now telling you to go push your body to its extreme, and you had a heart block or atrial fibrillation or something, and you passed out with a weight over your head, to me, I feel like they're all connected. And so I want to spend that time. I take a little longer, especially on that first visit. But after that, every time you reach out to me, I know Jamal, I know Mr. X, I know Mrs. Y. And so I don't really have to go research and see too much. I may refresh myself on something, but I know you very, very well. And so with concierge membership, as opposed to the old way, there's a membership fee. So it's a monthly fee. The other way is insurance, where every time you come in, you're paying a copay, and you have insurance premiums, and there's deductibles, and mine's just a monthly fee. Whatever you need, I've got you, basically, unless you need imaging or labs or something like that, that can go through your insurance. But you're more likely to reach out to me because there's not a punishment. There's not a copay punishment. There's not a travel punishment, because I can do video conferencing and talk to you on the phone, where now I've removed a barrier of care that is otherwise there. So there's so many, I could talk about that piece for 3 hours, but I'm sure you don't want
but
to do that.
I don't, because I think you made the point, and I'm obviously already a fan. And, but I want to talk a little bit about the Spa in San Antonio, about the kind of retail operation.
Perfect. And so this ties into what I was saying before. My approach to try to get prevention is to appeal to aesthetics, right? People don't really care about their vascular endothelium plaques on, feeding their heart. No one cares, but they care about how they look, right? And so if you can appeal to how they look, you can affect how they feel and prevent diseases. So that aesthetic appeal, I felt like, was a natural extension into Botox and filler and lasers and just making yourself feel good and look good. So I started the practice in San Antonio, then brought it to Austin. So now I'm partnered in San Antonio to expand the services from just medical, hormone, sexual health, preventative care, fitness, to now all the cosmetic stuff. And then what you can do there is that if you want to come in and be screened for diabetes, or do your yearly checkup, or you had an issue and you wanted a refill on something, and you also want to do Botox or laser hair removal, or really anything. We have every laser known to man. A lot of it is sexual health oriented too. So there's things like vaginal rejuvenation, where it's like a wand that actually tightens the vaginal canal. It improves lubrication, just the sensation. It can even help with urinary incontinence. So if you've given birth and you leak urine when you cough or sneeze, there's some hope that could help. So all the lasers and stuff kind of really dovetail and overlap with what I'm already doing. I will add those in Austin maybe in a couple of years, but here I'm just building out the hormone program, preventative care. I do testosterone pellets if you're a candidate. The sexual health, another piece of this is the PRP injection, where it will be offering it for men right now. We do it for women. Is basically drawing your blood, spin it down, take out the growth factors, and inject them back in vaginally. And this improves sexual health. It can improve lubrication, arousal, orgasm, desire. And so I just want you to be able to walk in and do anything, basically. I want you to talk to me about preventative care, but I also want you to feel good with the way that you look, you know?
So since you hit on the head, so you got your practice, you've got the retail spa, which I think is just a wonderful idea. I mean, folks can walk in and kind of get any number of aesthetic services and health services at the same time. Let's talk about, because you've hit on it several times, about sexual health. We are professionals, right? And so we talk about a lot, you know, we're both professionals, working professionals. But, you know, we are normally stressed, right? This is working professionals. You know, both men and women are normally stressed if you're a working professional and you got an intense job, or really kind of any kind of job. But now we're in a time where it's really, really stressful. Like, you got your job, which you've always had, and we got all this pressure and confusion and chaos and fear and worry. And I know, I have no shame to talk about it. I'm comfortably over 40, and I've been dealing with it for a while now, like just between the stress, the age, all the extra exertion from working out, being a parent. You know, it's impacted me in terms of my sexual function, in terms of my energy level in particular. Just, you know, I get to places where I'm just like, man, I'm exhausted. It's 3 o'clock. And yes, I may have been here. I'm either coaching, fixing a legal problem, trying to do a podcast, you know, whatever, trying to make sure I do something for my kids and all that stuff. And then 3 o'clock comes around and I'm like, I'm exhausted, but I'm not 80, I'm not 60, you know, I shouldn't be tired at 3 o'clock. And then I found out that it's, you know, my testosterone level is not high enough to kind of support really kind of the level of energy that I need. Part of that's age, and then part of it's stress. And so I imagine there are a bunch of other folks out there dealing with it. I'm sure you see it all the time. Folks dealing with this too. And I was shocked because I thought I was sick or something was wrong with me. And then you're like, let me check your testosterone levels. And well, that sure explains a whole lot. So I know that's got to be on people's mind right now, you know, like low energy, low libido, low everything right now, because this is tough.
Yeah, I'm glad you started with the whole coronavirus situation, because we cannot ignore the elephant in the room, right? This is a problem, and there's evidence already, especially from the SARS epidemic that we had back in the early 2000s, 2003. They did research papers that showed that, mainly for clinicians and healthcare workers, but depression goes up, anxiety, stress, insomnia. I mean, these are things that are a direct result of physical distancing, right? And the hardships related to physical distancing, maybe a decrease in your income or what have you. So all these things piling up on top of one of another, on top of each other, in addition to people like us, or, you know, anyone that has used to any type of activity in a public setting, now gone, right? Or you have to transition to something new. Activity itself reduces stress, anxiety, and depression. So now you have the isolation, you have the lack of your activity, and you probably find yourself snacking more, right? We're bored a lot more. You tend to eat when you're bored. That's going to put on some pounds. That's going to not make you feel so good either. And so there are so many factors. And then my own patients, even family members, have been having problems with either developing or kind of like a resurgence of their depression and anxiety because of this cabin fever. It's really difficult. And so what we have to try to do is look at this from every possible angle. The way that you eat, the way that you try to exercise, the type of relationships that you have, even virtual. People are doing virtual Zoom gatherings and stuff like that, you know, like
happy hours.
Yeah, happy hours, things like that. You know, it's whatever you can do to try to minimize your stress. But if we don't, another thing that complicates this is that if you have a hormonal issue, like you were saying, I look at everything, right? So I'm not just going to look at your testosterone and say, okay, you need that. We need to talk about whether you're a candidate for it. We need to talk about whether there's some other glaring problem, like relationship issue. Do you have a thyroid issue? Do you have diabetes? Do you have blood pressure issues? There's so many things that I'll look at, but that is a really important one that now is starting to be more in the spotlight. People are tending to care more about, even if insurance doesn't cover. They're like, what are they? What's my level? Which is good. People want to know. And so the other thing that can complicate this is that if you're on, let's say you're feeling not so good during this time and you're put on an antidepressant, or your antidepressant is increased, well, they can have sexual side effects. So you're in all these catch-22s. There's all these boulders and you're rocks and a hard place. You know, there's nowhere to go. So I feel like,
Stay right there though. Don't go
yeah,
over that because
yeah,
I have, you know, and I'm a pretty candid person, and even though this is mostly a professional show, I think they go hand in hand because it affected my personal life, in my professional life. When my mother died, I had to go on antidepressants. You
yeah,
know, I thought I was fine for 6 months. I was like, okay, I'm taking care of everything, and I was taking care of everybody else so much. And then 6 months later, I was like, okay, now it's hitting me. You know, I had the distraction of I had to get, you know, I had my work to do, and I had to take care of my dad, and I had to figure out all the plans and deal with the trust and the estate planning and all that stuff. And then after that stuff settled, 6 months later or so, then I had to grieve, and everybody else had already grieved because I was busy carrying all the weight. And then it hit me, and I got really depressed. I had to get on antidepressants, and I was on antidepressants for like 6 or 8 months, which were helpful. I took Lexapro, and it was really, really helpful. But what I didn't realize when I started taking it, even though my doctor, I think, might have mentioned it as well before I met you, mentioned, you know, but I just didn't expect the sexual side effects. I didn't expect any of the side effects really. And, you know, 6 months into it, all of a sudden, I'm like having sexual problems, you know, and that made it worse for me, particularly as a man and as a professional. You know, like you know, I only have so much time. I only have so much time to spend on anything, sex, food, whatever. And so right now, folks, I think are, you know, a lot of folks are experiencing higher depression, and are they, you know, what do they do? Like you know, there are drugs you need to take to kind of get you out of that hole so you can function and do your job and kind of be stable in your family and your other relationships. But then all of a sudden the side effects might put you in a situation where you can't access some of the things that make you feel better, you know, like sex, or even just feeling like going and doing something because, you know, you might feel better, but you just don't have a whole lot of energy or to move forward. So what do people do? Like, what do professional people do when they're trying to combat depression, but not get stuck with all these negative side effects? What are some of the things you kind of recommend for people?
Well, that's a great question. Let me address your first point. Thanks for sharing that story, by the way, because it can help me illustrate, you know, where I am. I'm partnered with a psychiatry practice where they're on
Right.
patients are on antidepressants, they're gaining weight, and they're having sexual side effects. So now they're non-compliant, which makes their depression hard. So this is where hormone replacement could come into play, right? Because some of these meds can decrease your testosterone level. So that's that for professionals. It's hard, you know, there really isn't any support really. I mean, you'll have hospitals having these meetings or the trillionth email of the day warning us about burnout. The irony is just, you know, ridiculous. Or having an hour-long conference in the middle of the day during your workday while you're still getting pages about how strategies to reduce burnout. Honestly, the medical profession is absolutely horrible at this. There is no answer yet for that. And in the news recently, I think it was this week or last week, the emergency physician who was running the ER program in New York committed suicide. You
Right.
know, everyone was saying she was generally a happy person, and kind of what you talked about, your cup being empty by pouring out into everyone else's cup, and then you have nothing left. And
Yep.
so it like the situation you were in reminds me of the ER doc. You know, you're doing what you got to do, but one day you have to sit down and be alone with your thoughts, and that's what you have to prepare for. And so, given that there's no solution or answer to your question there, I think what we need to do is just look up from our phones more. One, I think this has really helped us do that. I see neighbors outside that I've never seen before. You know, people are wanting to hang out. They're wanting to talk. They're wanting to come over for a drink or do a workout, like a social distance workout together. And so I think this process, hopefully, I think there will be ideas that emerge from hitting rock bottom, basically. And one of those things I think is just being in contact more, because if the only time, speaking with physicians, which is your question, if the only time we ever interact is basically us asking for favors, hey, can you consult on this patient? Does EKG look normal? What do you think about that? I need to send this patient to the ICU doc, tell you about it, or someone's coming out of the ICU to me. It's always when you get that page, it's always stress first. You're always wondering, now what, right? And so any kind of it sounds ridiculous, but if we can take it back to the 80s a little bit and just talk, hang out in the front yard and have meetings like the burnout meetings where you have some consideration and maybe do it on off days for people, or make them virtual, or make it like a lunch, something pleasant and non-stressful. I mean, if I'm in this meeting trying to look at your slides about burnout and I'm doing this, hold on, I got to go step up. What have I gained? You just stressed me out more.
Right.
Honestly, it's done the opposite. So that's a horrible answer, but that's the answer.
No.
Yeah.
So the message is really, I mean, which I think is the, you know, kind of what everybody's learning from this. Like the message really is slowing down,
Yeah.
appreciating your personal connections, making more personal connections, like being present. I mean, I try, like I think I talked about this in a few other videos, you know, I try not to incorporate too much of the metaphysical, whatever stuff into my coaching practice, but I do, but I can't ignore it. You know, I think because whether you're talking about hard science now, like in the hard science will back it up. The people that there's tons of studies that show like people that are like more present, more focused, more relaxed, are less stressed and they have less comorbidities with whatever they got going on in their life, you know. So I think that's the answer. Like people want to go back to the hard science thinking it's going to be a pill or you know some like some empirical answer, and the empirical answer is usually the woo-woo stuff of you need to just be a little bit more present in your day-to-day life and your relationships.
We're social creatures. We weren't meant to be in a dark room on a cell phone 10 hours a day. That wasn't, you know, what we were built for. And so another thing I noticed too about physicians is that a catch-22 is that we go like over a decade training, going into debt, and then we come out and we want to have some kind of a life with a house and a car or whatever. You're already $500,000, $250,000 in debt before you even start now. And so there is this pent up wanting for stuff, right? At first, you know, I'm not like that, but I think living within your means and drawing a line with what you're willing to do at the hospital or wherever that is important, because you can always make an extra X amount of dollars or Y amount of dollars, but you have to say, I think this is enough. And if you can mentally draw that line, for me, that's helped me, because you can always do more, you can always make more, but at the end of the day, we're all gonna, you know, we're only here for a few years on this beautiful planet, right? You only get a few years. And so at the end of it, okay, you amassed all this stuff, then what? You know, what would have been the point? So I think drawing a line somewhere, career-wise, asset-wise, whatever it is, goal-wise, you should always have goals, but in terms of what you're on the hook for, requiring active income strategies, I think it's important to do that.
Let me ask you this before we shift into the three things that I like to wrap up with. Because when this whole coronavirus hit, you were already busy. You were already, you know, seeing patients and working on the retail spot and everything like that. And then all of a sudden there's this increased demand for doctors and healthcare providers to come pitch in at any hospital, the hospitals they work at, the ones they don't work at, any hospital. And I know you stepped in in that regard. What was that like, and how did you manage that from a stress perspective?
It was stressful because the lack of PPE, for one, personal protective equipment, there just isn't enough, period, right? And so what's happening is that most facilities I've gone to, going a whole day using the exact same mask, which is clearly not what you want to do. And so the major stress for me was bringing a virus home to my family, right? And so it's like, what do I do? Do I just go work through this whole pandemic process and then quarantine myself for 2 weeks at the end of it and then go home? That's impossible, right? And so every day I come home, I know there's a chance I'm bringing something home. So that was really stressful. And then the fact that one thing that bugs me is that if this has killed over 60,000 of us already, Americans, right? And so I felt like if there was a terrorist attack and someone killed 60,000 Americans somewhere, war, right? And we would put all our resources behind it, whatever it costs, do it, pay it, let's go. But for this, it's like, whatever, you know, they'll figure it out. Let them just figure it out. That's really frustrating to me, not because of just us, but because if now, for example, with everything rolling back out and people going back out into public, there's recommendations to wear masks, which is good, right? But if we're already short on masks and we do that, we're going to have less masks. So when they come in, they're not going to be as safe. So logically, what's going to happen? There's going to be a huge second surge. And so that's very frustrating for me to, it is like a war. Some people call it the invisible enemy. If it's a war, you would supply, like during the, after Pearl Harbor, we're, you know, the Defense Production Act, they were taking over GM and making a fighter plane every 61 minutes and turning the spark plug line into a machine gun assembly line. Yeah. We can do that. We can make masks, right? And gloves and gowns. And so that's been the most frustrating piece for me, because I got sick, right? And I wasn't a candidate for testing for coronavirus because this happened early March. And I'm a physician. I'm treating all these COVID patients that I couldn't tell them for sure at that time were COVID because we didn't have testing. And so now I get sick. I'm in the ER. I have bilateral, which means both sides, pneumonias everywhere. I have fluid in my lungs. I can't breathe. I lost 15 pounds in a week. And then I self-quarantined for 2 weeks after that. So I suffered financially, physically, and I'm still waiting on the antibody test so I can verify this. But I'm healthy. I don't have any comorbidities. You see that I work out all the time. I eat properly. And for me to literally almost die, because I was barely saturating 90% at home, 100% is the most, but anywhere below 90, it's really, really concerning. And to get that 90, I was working really hard. And you can't work that hard for too long because you get tired. And that's when you fall into trouble. And now if you can't work hard, your oxygen levels plummet and you could be in a lot of trouble. So I feel like because of the lack of PPE, right? Just that one thing. I wonder now, was that the reason why that I got sick? I just don't think it's fair that I have to even wonder about that, you know? So
well, let's talk about that, because for professional people that are going to see this video, and I have no problem sharing my story, I still feel bad about it. You know, because I was one of the first people, I don't know how, maybe the first, but I came to you because I thought I had it. You know, I came back from California. I was convinced I had it. And what I've heard from most professional people who are relatively healthy, like me and you, is that they've had some sickness that they knew something wasn't right. Like I've had the flu before. I don't get it very often, but I've had the flu before, and I've had colds, and I've had all this stuff. I've had bronchitis and all that stuff. Like you at this point in my life, I generally know what it's like. Yeah. You know, I know to the point, like even when I call you, I can pretty much like, hey, I think I know what's going on here. I think I know what I need help with.
This is different.
But something was different. I was like, I just have never felt this sick where I had to totally change my plans. I haven't missed a day of work, like not helping my clients for being sick. I can't even remember 5 years or so. It's been a long time. Probably the only time I've done that was when my mother died. It's been a long time when I've not been able to actually sit up and do work. And then, of course, I reached out to you saying, hey, this is not normal. I don't know what's going on here. I need to see it. I actually came in to see you. And you had to tell me then that you couldn't have told me whether I had coronavirus or not because you didn't have access to the test information. And then as a result, then, you know, a few days, maybe a week or so later, then I'm checking in on you because we have that kind of relationship. And you're like, no, I'm self-quarantined. Now I'm sick, you know, and this is happening to a lot of professional people who are otherwise healthy, just having, even if you're not dying and end up in the hospital, you're still finding yourself so sick that you can't do your job, you can't take care of your family, you can't do the things you want to do, and you can't confirm how you got it or if you had it or whatever. And it's a really stressful situation to be in. You know, I feel terrible. I hope I'm not the person who gave you that, but I worried that I might have been, because I came to see you and we didn't know then about the dangers of the virus, because it was, you know, late February, early March. Like it was like the very beginning of the break. The government hadn't even responded to this yet.
Right. And I remember that. And I remember reaching out to an infectious disease colleague of mine, because I didn't know anything about it. It was so early. And he said, you know, probably not, but now I'm almost positive, you know. It's possible. I mean, you can pass it on. It's so contagious. But I, I do feel like all of us at some point, most of us will get exposed to this. It's just so contagious, and we're so connected that it'd be hard not to. But the point is to just make sure it's spread out over time. So you're not trying to bang on the emergency door because the hospital's full and people are lined up in the ER parking lot dying. That would break everything down, right? And so, but it could have been, maybe not, but and if it was, it was. But my point is that if there was a chance that it happened because we didn't have enough PPE, I mean, that's infuriating, right?
Right.
We should be able to stand for that. And then different hospitals have different levels of preparedness, basically. And some hospitals I'll go in, there's someone there stationed outside the room just for that. It's like, okay, doc, put this glove on, then this doc, okay, you came out, take that one off, wash your hands. And they're walking me through, put that over there. Some hospitals, like, yeah, just go in there. They're, you know, and so it felt like we were fighting something, obviously, but we were just totally alone. And it wasn't just us who are going to be affected by this, by the actual virus itself, but the situation and the stressor of having to deal with it. I know nurses that have said, not worth it, left.
Right.
Nurse practitioner I know left the field. And so it's that doctor I told you committing suicide. We're already short, right? We already don't have enough docs here.
Right. There was a provider shortage before this ever even happened.
Yeah, exactly.
There has been for like years.
Right. And so I feel like if this was any other kind of battle where we lost 60,000 Americans, I think it would have been taken much more seriously. But I think there is they'll figure it out mentality that is making things worse than it needs to be.
So let me ask you the three things so I don't take up too much of your valuable time.
Yeah.
As we close out, I'd really like to try to get people's perspective on these three things. And so three things. How are you coping? And we'll take them in turn. How are you coping through this? What are your coping techniques? How are you growing through this? And what's your plan for carrying forward whatever you've learned from this experience?
I'd like to answer that by saying that my growth during this period is helping me cope, and these strategies are going to be what I use going forward. So I feel like it's all related. And what I would say that I learned is that what's important, people, you know, I mean, I already knew that, but it's so much emphasized now that all the stuff we were trying to do, the growth and the bills and all the duties that we had, what's important is your relationships. So I'm focusing more on relationships. I'm cooking more, you know, I'm learning how to cook some stuff. I don't know how to cook a bunch of stuff. The few things I do are pretty good, but I'm trying to do that more. I'm reading more, you know, with the kids. And I've shifted my workout strategies from, you know, we see each other almost every day to family workouts. They're not, you had a post about this. They're not as efficient. Yes. They're super chaotic, but it's fun and it's sustainable because it doesn't involve much. You're doing it at home.
And it does a lot of good for this thing right here, your heart.
It really does. And that feeling where you go to bed at night and you're like, oh my gosh, my kid's this age, this much time went by. When am I going to get, I don't really do that anymore. I feel like, okay, I spent a lot of time with them today and yesterday and the week before that. And so reconnecting on a human level, even with my neighbors, we've had like a social distance, a neighbor come, you know, we're sitting on the lawn with lawn chairs, but that doesn't happen in real life. Again, I liken it back to the 80s where people just show up, ring your doorbell, or they're on the lawn. I just felt like, for me anyway, that was what my life was like. You can't call someone, is probably busy, right? Those were the days where you couldn't just click over. But so reconnecting with family, and then just career wise, you know, I want to do the best as I can relationship wise with my patients and cover what I need to cover. But I'll give you an example. A couple weekends ago, I just said, are you guys okay at the hospital this weekend? And they're like, yeah, the census isn't too bad. I'm like, I'll just stay home then. So the old me wouldn't have done that. But and talking about being sick, I had to go back real quick and say you hadn't called in sick for a while. It had been years since I called in sick, but I stayed home for 2 weeks because I couldn't breathe and I couldn't walk. And so this thing affects you not just physically, but you wonder, you know. I remember driving, well, Vanessa, my wife was driving on the way to the hospital, and I'm telling her about all the things that need to be done in case I die. Like, I literally thought that was a possibility, right? It was possible. And so when you go through that, or even the possibility of that, or hear about this friend dying, or that friend's mom's dying, or your cousin, or your grandfather, everyone, I think, at the end of this is going to know somebody, you know, that suffered badly from this. And so all that affects you, and I hope in a good way. So for me, this is the silver lining, because it's all about framing, right? You can focus on whatever you want to. I choose to focus on what good this will bring, I think, to society, connecting more, and drawing my line. Like I said, I don't need that extra shift. I don't need that extra weekend. I'd rather watch Frozen 2 for the 7,000th time with my kids, you know? So
That's my
I think
least favorite
I'm
Frozen, but yeah, I know what you mean.
no, I think, yeah, I think that's what I've learned, is to try to just slow down and enjoy some of the scenery while we're speeding to our destination, because all I was really focused on was, once I get down there, then I can start living life. Life doesn't work like that. You don't even know if you'll get there. So you may have just wasted all that time in your rearview mirror for something that never would have came anyway. So trying to just slow down a little bit and experience people more. That's what I think.
So, and if you've done all that, so what I want to know is, so, you know, you're coping well through this, particularly given all that you've been through, and you're growing. At some point, this is going to be behind us. I'm convinced that what's ahead is not going to look like what we left behind. So we're never going to get back to the way we were before. I don't think it's going to ever be like what it was in December of
Right.
2019, or January of 2020 for that matter. And how are you going to make sure you don't go back, though? How your ways don't go back to maybe you picking up those extra shifts when they're available, or, you know, going back to being so busy you're not spending as much time with your kids? What's your plan for making sure you carry forward the learning and the growth, so that this actually does improve your life long term?
I think that's just falls into the self-care category, right? It's like, how do you make sure you stay in shape? Get your butt up and get to the gym on time. Like, I have to keep reevaluating and asking myself every time I book something, do I need this, or do I want it? And if I don't need it, I really have to consider what I'm giving up to do that unnecessary thing, basically. And so I don't think it's a set it and forget it strategy. I think you just have to remain vigilant, like you would with what you eat, how you train, you know, work included. And so I just don't think we were, as a society, like that. It's just, we accept, you get up, go to work, come home, go to sleep, get up, go home. You know, you have to realize that work is there, yes, to help people in whatever you do. I think everyone's an essential worker in some sense, you know, and so that's important, but you're really doing that so that you can exist and have shelter and feed yourself and things like that. And so it should be an indirect thing, not the main goal, you know? So that's how I'm going to do it. I'm just going to remain vigilant and just keep reevaluating everything that I do.
You know, I think that, I mean, that's obviously very, very important, and I think we all got to do that. I'm really thinking, for me, I'm thinking really hard about my schedule,
Yeah.
and I used to be, you know, way more like, I don't know if liberal is the right word, because in some ways it was not liberal or liberating for me,
Yeah.
but I used to be like, okay, I'm gonna, you know, taking all these appointments, and, you know, scheduling and scheduling. Even when I go to the gym, I'm like, okay, I've allotted, you know, this amount of time to go to the gym, and I'm trying to cram it in. And if I would sometimes, like, you know, sometimes I'd see you at the gym and I'm like, I'm only gonna wave to Khris because I only got so much time. And other times, like, I can go sit down and have a conversation with Khris, or maybe we could try to work out together because I have more time. Now I'm going to be like a lot more judicious in my favor, with my schedule, and thinking, you know, I'm not going to be trying to cram like as much stuff into one day, so that, like, if I go to the gym and I see somebody, see one of my friends like you, or I mean, I can name a million people right now I can think
Yeah.
of at our gym that I wish I had stopped and had that conversation with, but I just kind of blew them off, or I was in a hurry and trying to make sure I got my workout finished so I could hop on a conference call. I'm gonna really try harder to like build bigger buffers into my schedule so that when I have those in-person experiences, I can actually enjoy them because I want my workout, right? I want to
Right.
get in my workout time, heavy,
And
weightlifting
that's
or
one of
whatever I'm trying to do.
the need, right? That's what we were talking about. Those are one of the needs. You need to stay healthy.
Yeah. Right, because I learned from this experience. I just don't work out well by myself. I like going to the gym. I just need the people, and I need that. And and so going forward, just taking that one example, like I think I'm just going to start making it where I don't book an appointment. I don't have anything to do for an hour after I expect to leave the gym, just in case I decide I want to sit and have a smoothie with one of my friends, or in case I want to work in with somebody, or in case somebody I've run into you and I'm like, hey, you got a few minutes? Let's sit here over in the corner and chat, or let's work out together, something like that. Because I need that as much as I needed the weights.
Yeah.
It wasn't the weights. I used to think it was all about the weights and the muscle building and all that stuff. And now I could go buy any kind of weights I want and put them in my garage. I got a bunch of them in there. It's not doing it for me. We'll be talking about that once we get going again, how I restart what I was doing before. So I think I'm going to be really intentional with my schedule and making sure I carve out enough time so that I can have the personal interactions I want to have with people when I get to have them again.
I love that. And that's kind of the journey, not the destination mindset that I was talking about earlier. And part of what you're talking about, that cushion, that buffer, also comes from reducing waste. For me, I'm cooking more and I enjoy it. It's fun. I'll put music on. The kids are running around or we'll be outside grilling and we're playing baseball or something back there. But there's a lot of waste that I didn't realize that doesn't need to happen. And if you don't need to expend energy to make money to pay for the waste, then now you have a buffer, right? As long as your career aligned, like I was saying. So I'm very much a similar mindset. I want more time to look around while I'm driving. I don't want to just light speed towards something that I may not even reach. And then
or even want when you get there.
Yeah. Yeah. What makes you think when you get there, now your mind's not you have to change your whole lifestyle to shift to enjoy that destination. So I don't know. I just feel like you don't know if you have 1 day or 8 years or 10 minutes, so just try to enjoy it more. It's not going to be perfect, but that's my goal, is to, with all personal growth, right? If you can get better every day, every week, every month, that's the goal. You'll never be perfect, but
My friend, my doctor, I am so glad we got a chance to do this. I'm so glad we got to share your perspective. I'm so glad we got to let folks kind of hear kind of what it was like for you as a very healthy, very fit, medically trained professional to actually go through a COVID-19 experience. Because I think a lot of folks think that this is easy, or this is a joke, or they hear stories, it's not going to happen to me, or I'm not at risk because I'm super healthy, or I'm young, or whatever. We're in the same age bucket. You're very healthy, very fit, whatever, and you still end up having to struggle really with it. So I hope folks will learn both that this is real, that they can take care of themselves, that it can happen to them, but more importantly, they can grow and learn from it and how to make their lives better, no matter what their experience is, whether it's quarantine, whether it's hospital, or whether they never even come in contact with the virus at all. So I'm really glad you showed up on this virtual lunch that no longer is ever. I think I've only had 1 or 2 people that actually ate lunch with me. So I'm going to stop calling this a virtual lunch date.
I tell you how lame mine was before we close out. So I'm doing intermittent fasting, so I don't eat till 1 p.m. So I'm like, great. So this is green tea because it won't break the fast. So this is the lamest lunch that you will ever interview.
No, well, it's actually, I'm glad you brought that up, because I think I've had to explain for myself, like a lot of times, I haven't been eating lunch either because I've been intermittent fasting, which I had stopped doing because I was like, I don't know if I really need to do this. I can just go work out. But now I'm like, I'm not working out as much as I can. So, or as much as I'd like to. So I'm doing what I can, which is the intermittent fasting. So my lunch is like sitting here. You can't even see it because of the virtual background, but it's all wrapped up in saran wrap, waiting for me to hit 1 o'clock when I can eat eat it.
Nice. And you mentioned intermittent fasting. That there's evidence that shows that it helps depression. So in this time, I mean, if your doctor clears you for it, it might be worth doing. It doesn't cost anything. It's literally the opposite of costing something. You're not eating 16 hours, then you eat for 8 hours, but keep it up. See, you're good.
Well, that's the one thing. You're right. That's the one thing. Like, if you can't work out, which we don't have control over all that. I mean, you can be physical, but one thing you can control is your diet. That's something we always have power over, what we put in our mouths, right? And so, whether you're controlling how much you put in your mouth or how often you put stuff in your mouth, you have an ability to control that. And that, for me, because I was panicking a little bit, I was like, oh my God, I don't want to balloon up into the fat again or all this stuff, and I was like, but I just can't motivate myself to work out, like I used to. So I was like, okay, I don't want to feel powerless and feel like I'm just going to be stuck, so then I was like, okay, what can I do? And that was the intermittent fasting.
It doesn't take much. Go for a walk, go get the mail, or just do something. As you do more and you start eating right, it's kind of like if you don't work out at all, it's much easier to have those cookies. If you just did a workout, you don't really want to touch them because I'm just going to undo all that work I did. It is a total, you just have to convince yourself and stay distracted. I think distraction is key. When you're bored, that's when things start to go south in a lot of different ways. Do something, take up a hobby, go for a walk, go observe nature, watch a movie, stay distracted.
Well, as anyone could tell, I could probably go on and on about this with you for hours and hours and hours, but I don't want to take up so much of your time. So I'm going to say again, thanks so much, my friend, my doc, for being on the show.
Jamal.
And I look forward to seeing you again real soon.
Yes. Be safe. Wash your hands.
I will. Bye, Doc.
See ya.
See you later.